Leiomyosarcoma, LMS for short. So I usually just call it LMS now. So it's it's a soft tissue sarcoma. And soft tissue sarcomas make up about 0.7% of malignancies, and about 5 to 10% of those are leiomyosarcoma. So LMS is a very rare type of cancer, and it's even a rare sarcoma. So LMS is a smooth muscle sarcoma, so it can occur on any smooth muscle anywhere in the body. So, you know, we have smooth or involuntary muscles everywhere in our body. And so my particular LMS was in my lower abdomen area. They call it retroperitoneal leiomyosarcoma. So it was in my lower abdomen, just behind my intestines. And a lot of people have uterine LMS. A lot of women will have uterine LMS. And a lot of patients will have retroperitoneal LMS. And of course, there are other sites too. So I was diagnosed June 2014, so almost 3 years ago. And, you know, it's especially difficult when you first, you know, those first couple weeks, week to 2 weeks, when you receive a diagnosis like this, you know, your immediate reaction is to go online and check things out. And you know, you can tend to be a little quite fearful, you know, when you read those things. So I think it's important to just, you know, remember to try to relax, you know, take some deep breaths and know that, you know, whatever your experience with this is going to be, that you can get through it, that you'll be okay. So it's just, you know, it's scary at first, you know, to be diagnosed with a cancer. But, you know, you certainly get an education. You learn that there are so many different types of cancer, and there are so many different types of treatments and drugs, and every patient reacts differently to the drugs that they have, that oncologists usually recommend. So my experience with it is, so I was not diagnosed until after I had surgery. So I had a lower abdominal mass that was quite large. I had a CT scan, and the radiologist thought that it was possibly a type of sarcoma. And I didn't have the diagnosis until during my surgery. So they, at the time, they thought it was uterine LMS. So they did a complete hysterectomy. They removed some lymph nodes. I had a partial colectomy. I think that's what the surgery consisted of. And then after the surgery, I began chemotherapy. And that lasted, the first time I had chemotherapy, it lasted about 6 months. And it was with gemcitabine and Taxotere, which are 2 drugs used together that probably most oncologists use in treating LMS. And so I went through that, and then I have CT scans every 3 months. And I have had since my diagnosis. I've had CAT scans every 3 months. And then I just kept having scans every 3 months, and then they discovered that I had some metastases in my liver and I think 7 different bone sites. So then they tried radiation on my liver, and that really didn't, we didn't really have any results with that. And then I went on an oral drug, an oral chemo drug, and that caused me to have really bad headaches. And that it was determined that that really wasn't working too well. And just, you know, another thing too, you can have metastases, I've noticed or come to realize, And, you know, you can still live a long time with those mets in different sites. So then I had, let's see, fall of 2015, I had, or I'm sorry, 2016, I had another round of chemotherapy. This time with a drug called, I can't think of the name of the drug now. It'll come to me probably in about 5 minutes, but a different drug than the first time. And so this particular drug, chemo drug, did cause some slight reduction in some of the nodules, which was great news. But, you know, I feel really good, and, you know, I kind of just go from scan to scan, you know, and then after each scan I meet with my oncologist, and, you know, whatever the results of the scan were, then he can recommend treatment, or, you know, or we just, if it has shown no growth, then, you know, I just do what I've been doing. So I kind of have done some holistic things in addition to, you know, the medical field, what they offer. So, and I guess first of all, too, what I would recommend to anyone is it's very important to try to find a treatment center that treats your particular type of cancer. So I live in Southern California, and so I'm very fortunate to be able to treat at UCLA because they have a sarcoma center at UCLA. And so those oncologists meet together often. They're experts, you know, in the country. If you can treat at a sarcoma center, they have a lot more experience with your disease than, say, a regular oncologist would have. So try to find a treatment center that treats your particular type or your particular disease. I don't know, I think most diagnoses are probably, you know, over age 45. But there, you know, there have been a lot of cases that I've heard of where younger people, you know, might have them in either a smooth muscle on their arm, or on their legs, some other sites, maybe more so than the abdominal area.